With millions of Americans still resistant to getting a COVID vaccine, there's stunning new reporting in the New York Times that shows the growing partisan divide fueling some of that resistance. According to the Times' David Leonhardt, that divide is so large that, quote, almost every reliably blue state now has a higher vaccination rate than almost every reliably red state. Even more shocking, the consequences for deaths from COVID in areas that supported the disgraced ex-president. From that Times reporting, quote, in counties where Donald Trump received at least 70% of the vote, the coronavirus has killed about 47 out of every 100,000 people since the end of June. It's according to Charles Gaba, a healthcare analyst. In counties where Trump won less than 32% of the vote, the number is about 10 out of every 100,000. Let's bring into our conversation the aforementioned David Leonhardt, senior writer for the New York Times. Also joining us, MSNBC medical contributor Dr. Nahib Bhadelia, director of Boston University's Center for Emerging Infectious Diseases Policy and Research. David, you're writing some of the best, in some cases reassuring, in other cases shocking stuff about where we are with COVID right now. Explain the political divide.
Thank you, Nicole. Well, we've had a political divide on COVID for a long time. I mean, I drove across the country in January and left blue suburbs and found myself in the midst of red areas and was shocked by how little mask wearing there was there. But earlier, there wasn't this big divide in terms of the effect. Yeah. Masks do help, but their effect is limited. And the blue parts of America are the parts where we tend to have our busiest airports and our most international travel. And so blue America was actually hit harder by COVID. The easiest way to see that is New York, originally. But the vaccines are so powerful that they have changed the story. And we now see these massive vaccination gaps. I mean, the suburbs of San Francisco and New York, the Madison, Wisconsin, the entire state of Maine now have vaccination rates of 80% of eligible people. And you look at red communities, very conservative rural communities across the country, and you see vaccination rates among the eligible below 40%. And it's creating this tragic situation in which we are having many, many unnecessary COVID deaths, and they are disproportionately, highly disproportionately in red America.
You know, Dr. Bhadelia, like so many things that we cover, I kept thinking there'd be a tripwire and that tripwire would be kids in the ICU or pregnant women dying. And it turns out we do not live in a country with any tripwires when it comes to the tragedy that we're dealing with. And I want to read some reporting from the Washington Post. Matthew Trunsky, pulmonologist and director of palliative care at Beaumont Health in southeastern Michigan, wrote this on Facebook. When a well-regarded intensive care unit nurse told him during a recent shift that the wife of an unvaccinated COVID patient had berated her when she informed the woman of her husband's deteriorating condition, Trunsky, who has lost more than 100 patients to COVID, reached his breaking point. When he got home that evening, he made himself a sandwich and opened Facebook. Still sporting his black scrubs, he began to vent. He wrote about a critically ill patient who disputed his COVID-19 diagnosis. Another threatened to call his lawyer if he wasn't given ivermectin, an anti-parasite drug that is not approved for treating COVID. A third, Trunsky wrote, told the doctor they would rather die than take the vaccine. One demanded a different doctor. I don't believe you, he told the physician. What can you do for patients like that as a doctor?
Yeah, Nicole, 7 years ago, I was treating patients in Ebola treatment units in Sierra Leone. And a couple of times I would have patients not willing to take treatment, just not believing they had Ebola, thinking the whole thing was a hoax. And that's, a country with fewer resources, much lower health literacy. But they also had this very bloody civil war about 10 years before that. Outbreaks tend to take on the shape in the societies that they affect. And right now, what's happening with COVID is really a symptom of the larger pathologies that are going on in the U.S. We can take care of the patients the best we can, but one of the other points that David makes in his insightful article is that this is this larger move towards anti-science, and it has secondary impact, right? Because what's happening is if you discredit your doctors and your scientists and your government officials, then what you're saying, well, believe me, let me give you this other drug that I think works, right? It's creating a vacuum by completely having the population lose trust in credible sources. You are allowing all the snakes of salesmen to take over, and that's what we're really seeing.
But Dave, you know what's amazing to me is there's not been a vacuum. I mean, there's been so much information from doctors and traditionally trusted sources since the beginning. And other than the first 3 weeks, we were not sure if masks help, and then they decided they did. And on the phasing of boosters, the advice has by and large been life-saving, as evidenced by your trip through the country and the people following the advice living and more people not following the advice dying. I wonder if sort of based on all your reporting about the Delta variant and all your reporting about the regional and political breakdown, where you think we're heading?
I think figuring out why this has happened is really difficult. I mean, it's clearly related to a larger breakdown in trust in society. In all kinds of ways, we see that less educated Americans, the typical way social scientists draw the line is people who do and don't have a college degree. Less educated Americans are just faring worse by almost every measure. They're less likely to be married. They're less likely to report that they're happy. They're more likely to drink more than is healthy. They're more likely to be addicted to drugs. There's this phrase, deaths of despair. And I think of this actually as sort of a cousin of that, which is life has become sufficiently difficult, and there's a sufficient level of cynicism for a lot of Americans that they are behaving in ways that are actually self-defeating. And I think we're in this emergency now, we're in this crisis. And so I recognize that a lot of people in Red America aren't going to listen to the New York Times, and they're not going to listen to Dr. Fauci. The one thing I would say is I think it's important to reflect for a minute on the notion that you're being snookered. Donald Trump has taken the vaccine. Most of the people on conservative cable TV who are raising questions about it, they've taken the vaccine. The Republican governors who are playing footsie to try to say whether the vaccine's good or not, they've taken the vaccine.
Right.
And so I guess I would say to people who are living in Red America, the people who are feeding your cynicism, they have taken the vaccine. And that might be the strongest message of all about what's actually good for you in this situation.
Well, and Dr. Bedelia, to sharpen the message, the ones that didn't drop dead, I think 5 conservative radio hosts died of COVID, and some of them had family members pleading with their loved ones, listeners, to take the vaccine. Do you think, though, that if we head to a point where the Pfizer vaccine is approved for kids, do you think we just kind of stagger through this pandemic with our divisions just hardening with every new innovation? It's only accepted and trusted and taken advantage of by the people that trusted the last vaccine and took I mean, with boosters and kids, we should be entering new phases of rolling out more life-saving medicine to more people. And yet we're in this hardened divide.
I want to be optimistic, but my concern is, as you covered earlier, is that I think that the parents who got vaccinated will vaccinate their children, and we will hobble through with, unfortunately, more people getting infected who didn't get vaccinated, and people who got vaccinated vaccinating their kids, and having us reach some sort of level of population immunity. But I do want to. One point you made is so critical, which is that it's not just about the now, because it's purveyors of disinformation, those who are using this to gain political points, right? You're seeing this sort of anti-science spread to other vaccines. There's a conversation now about whether measles, mumps, and rubella vaccine should be required in schools, which is it is in so many schools, right? We achieved herd immunity in all those different diseases because of these vaccines, and the cynicism that's being fed to a large segment of the population may then lead to erosion in all those well-established vaccines, let alone a future vaccine or future outbreaks that might be down the road.